Hi there, I'm Howard Leibrand. I'm the Island County Public Health Officer. We've never had a situation like this, like the COVID pandemic. We've had minor outbreaks of disease, we've had situations that had to be dealt with, but nothing that's anything like this. We were successful in mitigating the spread of the natural COVID virus, and the pandemic was essentially over at one point. Then the Delta variant hit. The Delta variant is a natural modification of the virus that made the virus far more effective. It's 6 to 10 times more contagious than the original COVID was. So in our effort to fight this new virus, the Delta variant of the COVID virus, we have to do things a little bit differently. We've reinstituted masking, for example, in indoor situations and in crowded outdoor situations, and that's very important. Masks are safe and masks are effective. They don't completely stop the transmission of the Delta virus, but they certainly add another layer of protection that you wouldn't have without them. The other thing that we depend heavily on is vaccination. In my 31 years of doing public health, the vaccination that we have for COVID, the 3 of them that we use here in the United States, are probably the best vaccines that we've ever introduced in a disease situations. They're really a dream vaccine. And the vaccine was developed quickly, and I know that's a concern to some people, but I think it's a little bit of a misinterpretation of what actually happened. The vaccine platform, the mRNA vaccine platform for the Pfizer and Moderna vaccines, was already in existence. Much research had been done on it since the time of MERS and SARS, our previous experience with coronavirus, and that all it required was putting the new information from the coronavirus into the vaccine platform that we already had. People think that possibly this was done without care and without testing, but it wasn't. I mean, nobody cut corners with this vaccine development. The only thing that was cut was red tape. The other thing that happened is that the number of research hours that went into this vaccine was probably similar to a vaccine that took 5 years to develop, because so many more researchers were working on this vaccine, so much more money was poured into this vaccine that we were able to do a lot in a short period of time. The vaccine now has been fully tested. The Pfizer version of the vaccine has full final authorization from the FDA, and the testing that's been done is been phenomenally positive. We know that this is a safe vaccine. You hear stories about the problems that occur with people after the vaccine. A lot of those are just that, they're stories, or they're media over-dramatization of a single event that is so often repeated that it sounds like it must have been multiple events. But if you look at the data that's been collected about this vaccine, we've given over 300 million doses of vaccine in the United States, and the number of complications, serious complications related to that has been very low. And the vaccine is also very effective. The disease rates in people who have been vaccinated are far lower than in people who have not been vaccinated. You're 8 to 10 times more likely to get COVID if you have not had the vaccine. So the vaccine protects you from getting COVID. It also protects you from having severe COVID. If you are unlucky enough to get the disease, you are 25 to 40 times more likely to be hospitalized or even to die from the virus if you are unvaccinated. Well, for example, I talked to a friend who works in a CCU down in a big hospital in Seattle, and of the 34 people that were in their CCU, one of them had received vaccine. Again, the vaccine is not perfect, but it changes the odds overwhelmingly of you getting the virus initially, and even more overwhelmingly of you having complications from the virus. So I think that there's just no question that it's an effective vaccine. There's no question that it protects us from the disease, and more importantly, from the severe aspects of the disease.